thing is asymmetry of the face should be written. Due to a swelling present on the right middle third of the face, or if you are sure it is present on the maxilla, you can write on the right maxilla there is a swelling present. Okay, you are going to write about if the swelling is going to be diffuse or well defined. Usually, any swelling that is acute presence, patient tells you that it presents only for the past 2 days or 3 days. It will be a diffuse swelling that is present, that is caused due to an infection. So when there is a swelling, diffuse swelling that is present on the right maxilla. If it is going to be present on the right lower third of the face, you are going to write on the right lower or on the left lower third of the face. Okay. So on examining, you will write without touching the patient before palpation. You will write there is a diffuse swelling present in the right middle third of the face. Okay. Extension again, you are going to use landmarks. Okay. So this right ala of the nose can be the anterior extent. Posterior extent can be the right tragus of the ear or the earlobe that can be used as an extent. Okay. If it is not extending from here, you are going to write it is going to extend 2 cm from the ala of the nose and 3 cm or 4 cm from the tragus of the ear as the anteroposterior extent. Superior inferior extent can be the outer canthus of the eye, which can be the superior extent, the inferior border, which can be the inferior extent. If not, it is extending more than, if it is not extending more than the corner of the lip, you can write it extends to the line joining the corner of the lip and the tragus of the ear. If you draw an imaginary line between the corner of the lip and tragus of the ear, this can be the inferior extent. Okay, so that will be the extent of the swelling. After which you are going to see for the color of the swelling. Similarly, when you saw the color for an ulcer, the floor of the ulcer, you are going to see if there are any color changes for a swelling present. Okay. Usually, if there is a cellulitis that is present, there can be, and the patient, if he or she is light skinned, there can be any redness that can be seen over the swelling. If not, you are going to say the color of the swelling is similar to that of the color of the adjacent skin. Okay. So, color you have written. Extent you have mentioned. You are going to mention now the measurement. Okay, you have to take a metal scale and measure it, or approximately write that it measures about 5 to 6 cm. Okay. After which you are going to check if there is going to be an obliteration of the infraorbital fold for a maxillary swelling or nasolabial fold for a maxillary swelling, which means when you are able to appreciate the fold when the patient's mind is fine, you will be able to appreciate the folds here. If there is a swelling, the folds will not be appreciable. So you are going to write there is obliteration of the infraorbital of the nasolabial. Okay. On palpation, again on surface changes, you are going to see if it is a smooth swelling. You are going to see if it is going to be, with no surface changes, meaning there is no pus discharge or bleeding from the swelling outside. Okay. On palpation for a swelling, what you have to see is you have to see for compressibility and reducibility. If the swelling is going to be soft, you are going to compress and see if the swelling is going to form indentations and it be compressible. Reducibility is if the swelling size is too large. Maybe you are examining a smaller swelling that is present. If the swelling on compression is going to reduce in size and then enlarge, it is reducibility. If the swelling is having any fluid content inside the swelling, it is going to be fluctuant. So on fluctuancy, you are going to see if the swelling moves by using toothpicks. Okay, so 3 things you are going to see: reducibility, compressibility, and fluctuancy for the swelling on palpation. Again, you are going to see if the swelling is tender on palpation, touching the swelling. Okay, and the base of the swelling also should be written. If it is a broader base, it is going to be a sessile swelling. If it is going to be a growth which is movable, it is going to be with a pediculated base. Okay. Last thing is you have to check for the warmth of the swelling. That can be done by removing the glove and then checking for the warmth of the swelling on both sides. Okay. If the swelling is warm, it most usually indicates there is an infection going on and there is warmth that is present. That can be examined. Okay. On palpation again, you are going to check on compressing or reducibility if there is going to be any pus discharge from the surface of the swelling. Then you are going to write there are no secondary changes, or if present, you are going to write secondary